Hi, I'm Anna Christie. You may remember that a few years ago, 10 years ago actually, I made a video for YouTube about how we treat emetophobia. And it's taken me a long time to update it, and I'm sorry about that. But the thing is that treatments have changed. We have learned a lot about emetophobia in the last actually 10 or 12 years. Although treatments today are not that different, there is one distinction. So I'm just going to let you know now how we treat emetophobia and how therapists should be treating emetophobia today. First of all, there's only one way out of emetophobia, and that is through exposure and response prevention. Now, exposure sounds really scary. It sounds like you have to vomit or you have to watch scary videos or go to an ER in a hospital or something like that. But we don't make people do any of that. Not for a long time. First of all, we never make people vomit because that doesn't help. It doesn't work. Um, and we don't make them do scary stuff or suggest that they do scary stuff for a long time until you're ready for it. Think of a stairway or a ladder. You can't get to the top rung without going through all of the other rungs of the ladder first. And once you're on the second to the top, it's an easy step to the top. So don't think about what you have to do at the end of exposure treatment now, because you can't. It's like trying to go from the bottom to the top of a ladder with just one step instead of going rung by rung. So let's start at the bottom. We still do exposure and response prevention very slowly and gradually. This is important. It has to go in order of the easiest thing to the more difficult or most difficult things near the end. So we start with things that are really simple, like looking at the word vomit printed on a page, or some other words that mean the same thing. Then the next rung of the ladder would be looking at a drawing in pencil of someone who doesn't look very well. Not hard, right? When you think about these things, maybe you want to look at a black and white cartoon of a cat coughing up a little hairball that looks like one of those things in the desert. I can't remember. Tumbleweed, that's it. It's simple little cartoons. Then we look at cartoons of people that look nauseous. Then we might look at real pictures of people who look nauseous. Then we look at pictures of people after they have vomited to see what they look like there. Then we might look at pictures of vomit without people in the picture. And again, those pictures would go in order, starting with fake vomit to maybe some cat vomit that's been cleaned up on a rug already, and so on. Very small steps. The difference between now and 10 or 12 years ago is what we used to do was have the person look at the picture, and then if their anxiety went up, we would teach them skills to bring their anxiety down. So we would teach them slow breathing, slow, consistent breathing, relaxing their body, maybe imagining a peaceful place. We found that, first of all, if that's going to work, and it does work for some people, it worked for me, but if it's going to work, you have to dedicate almost an hour or 2 hours per day practicing breathing and relaxation, progressive muscle relaxation exercises in order to get good enough at it to be able to control your anxiety. So most people can't do that or aren't willing to do that. The second thing is that we found that the phobia tends to come back when you use that as a treatment method. So what we do now actually makes a lot more sense, and I feel like I wonder why we didn't think of it before. What we do now is to have people's anxiety just go up a little bit. So from 0 to 10, where 0 is no anxiety at all, and 10 is the worst panic possible, maybe we want your anxiety to go up to 3 or 4. And you can feel that somewhere in your body. Maybe your heart's going a little faster. Maybe your palms are getting sweaty. Maybe you're breathing a little faster. Maybe you can feel butterflies in your stomach or a rush of adrenaline somehow. And when you feel those things, we want you to just take note of them. Like say to yourself, okay, this is 4 out of 10. I feel it here, here, and here in my body. And I'm just going to leave it alone and do nothing. Nothing at all. In that way, the part of your brain that's giving you the trouble right now is in the middle near the back. It's called the amygdala, and it's only responsible for your survival. Why things to do with vomiting are triggering your amygdala, we don't know, but it doesn't really matter. We have to teach your amygdala that there is no danger and that you will survive regardless. Now, you may say, oh, I know I'm going to survive. Yes, but you know it in the front of your brain here, the neocortex, right at the front of your forehead, the part for logic and reason and mathematics and so on. You know that you won't die from vomiting, but your amygdala doesn't know that. And unfortunately, it can't really learn it without. Okay, I've got lots of alarms going off in the middle of my video. That's all right, I'll cut it out. So, yeah, alarms going off, right? Your amygdala doesn't know it. For some reason, your amygdala thinks you're in danger. So if you do nothing in the face of this danger, even though it's only a really tiny little bit of raised anxiety, if you do absolutely nothing, your amygdala says, well, they're not doing anything. They're just sitting there. So I guess it's not dangerous. And that's what we want. This we call acceptance, from acceptance and commitment therapy, or ACT, ACT. Or we talk about it being tolerating feelings of anxiety, learning how to tolerate them and leave them alone and do nothing about them. That way, over time, and don't forget, this process can still take a couple of years, maybe only a few months in therapy, but a couple of years after that of going out into the world and experiencing things. It might take a couple of years before your amygdala really learns not to bother triggering you at all and giving you the anxiety in the first place. And then you'll hopefully become like me, where things to do with vomiting don't trigger me at all. So I hope this has been a helpful video for you.